Hi, I'm Taylor,
And I'm Cynthia.
and we are doing stimulants. So for the first class of drugs, we're going to do amphetamines. This is a CNS stimulant. Most people know it as Adderall. It's a category C for pregnancy, and it is a Schedule 2, so there is potential for abuse. Serotonin syndrome is something to look for that, and we'll talk about that more on the next slide. So Adderall and amphetamines, most of these drugs are used to treat ADHD. What this does is it increases dopamine, norepinephrine, and some serotonin, just to level the brain out. It's supposed to increase alertness and lessen drowsiness. Recommended dose is 5 to 60 divided in doses throughout the day. But you, of course, want to avoid taking this before bedtime because it's a stimulant, so you won't sleep. Some side effects are serotonin syndrome, since it blocks the reuptake of that. It affects the heart, rhabdomyolysis, Stevens-Johnson syndrome, epidermal necrolysis, anaphylaxis, and angioedema. We want to make sure or know that there is a history of substance use disorder, and then contraindication is also hyperthyroidism, the use of MAOIs in the last 14 days, and cardiovascular and hypertension. Avoid taking antihistamines. It also interacts with antihypertensives, so like beta blockers and stuff. Lithium, which is another ADHD drug in a different category. Proton pump inhibitors, so like omeprazole, Prilosec, St. John's wort, and grapefruit juice, because grapefruit juice can inactivate the active ingredients. Onset is 20 to 90 minutes with a peak of 1 to 2 hours. The duration is 3 to 6, and the half-life is 9 to 12. We mentioned earlier that the neurotransmitters are dopamine, norepinephrine, and serotonin. Obviously, we don't want to give this within 14 days of MAOIs or hypertensive crises. Do not take at night because of insomnia we already mentioned. And inform prescriber if pregnancy occurs, because it's a category C, which isn't great. If there's an overdose, we use benzos because there's a risk of seizure in an overdose with amphetamines, and then activated charcoal and fluids for rehydration.
Now we have dexmethylphenidate, and it is also a CNS stimulant, brand name Focalin, pregnancy category C, Schedule 2 controlled substance. It may cause CNS stimulation, mania, and psychosis. It can also worsen behavior disturbances and thought disorders. This is also for treatment of ADHD, and it increases norepinephrine and dopamine in the synaptic cleft. Its recommended dose is 2.5 to 5 milligrams daily with a max of 10 milligrams. Side effects: aggression, anxiety, headache, hypotension, hepatic dysfunction, angioedema, and rhabdomyolysis. Is contraindicated for MAOIs within 14 days, and it interacts with antihypertensive and serotonergic drugs. Its onset is unknown. Peak is 1 to 1.5 hour. Duration is also unknown, and its half-life is 2 to 4.5 hours. It works on the norepinephrine and dopamine neurotransmitters. Monitor for signs of dependence. Also monitor the patient's CBC and differential, as well as platelet counts. Teach the patient the importance of letting their prescriber know if they experience irregular pulse, fainting, or chest pain on exertion, and then also educate male patients and patients or caregivers of male children for the risk of frequent and prolonged painful erections.
So the next drug is dextroamphetamine. It's pretty similar to the first amphetamine we talk about. The brand name is Dexedrine. Still Schedule 2, still pregnancy category C, and a big warning is serotonin syndrome again. This is once again used to treat ADHD. Same thing with the dopamine, norepi, and serotonin, because it's pretty much the same as the first amphetamine drug. Same recommended dose, pretty much the same side effects, and honestly, it's all pretty much the same. Same overdose protocol and everything, so this one was pretty easy peasy.
Now we'll look at lisdexamphetamine, brand name Vyvanse, still a CNS stimulant. Pregnancy classification is still category C. Controlled substance is Schedule 2. And you want to watch out for serotonin syndrome. Another one for the treatment of ADHD. It also increases the norepinephrine and dopamine, which causes decreased motor restlessness and increased alertness. The recommended dose, 30 milligrams once daily. You can increase it in increments of 20 milligrams, but the max is 70 milligrams daily. Side effects, seizures, serotonin syndrome, cardiomyopathy, hepatitis, rhabdomyolysis, Stevens-Johnson syndrome, toxic epidermal necrolysis, anaphylaxis, and angioedema. Contraindicated with MAOIs within 14 days, and it interacts with buspirone, fentanyl, lithium, SSRIs, SNRIs, St. John's wort, tricyclic antidepressants, and then its onset is 2 hours. Peak is 3.5 hours. The duration is 10 to 12 hours, and half-life, which I thought was interesting, is less than 1 hour. Still just the norepinephrine and dopamine neurotransmitters are affected. It shouldn't be given to patients that have cardiac problems, and you need to monitor bipolar patients for mania. Take it in the morning so that you don't have insomnia since it's a stimulant, and then inform providers because serious drug interactions can occur. And the overdose, you would use benzodiazepines, activated charcoal, and fluids.
So the next drug is methylphenidate, also more commonly known as Ritalin or Concerta, another CNS stimulant, still Schedule 2 and still Cat C for pregnancy, and again with the serotonin syndrome. Ritalin is again used to treat ADHD, increases dopamine and norepi, used to decrease like restlessness and improve concentration. There is a lot of different dosages for this, but max is 60 milligrams a day divided into 2 to 3 doses. It can increase depression, cause agitation, suicidal ideation is a big one. Angioedema, it can decrease your platelets and white blood cells. In neuroleptic malignant syndrome, which is pretty big to look out for. Contraindications include glaucoma, Tourette's, MAOIs, and anxiety. The only food interaction for this was caffeine, which I thought was interesting. Onset is 20 to 60 minutes with a peak of 2 to 4 hours. Duration of 3 to 6 and a half-life of 3 to 8. Ritalin is known to may perpetuate psychosis in patients who have had psychosis before, so you really want to look out for that, along with the depression and the suicidal ideation. There's a big warning for signs and symptoms of drug dependence with Ritalin. It's very addictive. And then monitor for serotonin syndrome also. You really want to teach your patients that dosages should not ever be self-adjusted. Always talk to your provider first, and you really need to monitor for the rashes, excessive nervousness, vomiting. That's all included in serotonin syndrome. And then, of course, report your suicidal ideation if you're experiencing that. For overdoses, treatment is just oxygen fluid and activated charcoal. And this is just our reference for the NDH drug book. Thank you.